Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast, brought to you by ablehealth.us. And today I want to talk about the importance of prevention versus rejuvenation. Both of them are important, but prevention is so much easier than rejuvenation, which means that old saying, an ounce of prevention is worth a pound of cure, like that is almost even true from the ratio aspect that they picked on that. Like the amount of work that you need to do to prevent something versus fix something or to basically start over again in all aspects is true. So the thing is, in mainstream medicine, they don't really do anything in terms of prevention. That's not their game. I feel like that's the most important game of health, is preventing people from getting sick. I don't know if this story is true, but I remember hearing that in Asian culture, the doctor was paid only when you were healthy. And if you weren't healthy, then the doctor didn't get paid. So prevention was literally the name of the game. And I feel like that should still be the name of the game. Get things early. Check everything early. Maintain it. Maintain. It's so much easier than trying to start over and fix things. So, because sometimes too, you don't even realize when you're not maintaining things that all of a sudden it's gone and you're like, oh my goodness, like now I have to do all this work to try and get this back. I want to go through 5 examples of things that it is really important for you to work on to maintain as opposed to trying to start over again. Now, obviously, with this being the Paramena Bliss Podcast, this maintenance is going to be with relationship to your hormone balance. We're going to be talking about diet. We're going to be talking about exercise. It's the same main tools, but their effectiveness in terms of maintenance is key. So, number 1, your skin. If you haven't seen any negative changes or if things are just kind of starting to happen, I've had clients when they've come in their late 30s and I'm doing acupuncture treatments for their skin, I'm doing some hormone balance, and even for the people in their late 30s, I might not even be giving progesterone or anything at that point. I'm just working on things to help balance their hormones or detoxify their skin. And the effects are always amazing. Like when they're young, the younger you are and the earlier you start, the faster the effects kick in. And then as you get older, if you start it, you still get the effect, but it's nothing like the preventative effect. You'll see like fine lines literally disappear on someone, whereas versus saying really deep wrinkles get shallower. The effect is always more dramatic when you're younger. So for the skin, you definitely want to make sure when it comes to the hormone balance, because estrogen plays such a huge role for the elasticity of your skin. So if you wait until your estrogen levels have dropped, and then therefore your elastin levels have dropped, you're not going to may always do something to get those levels back. So if you can maintain them throughout, you're going to see a so much better effect. Same concept for your hair. Don't wait until your hair is brittle, thinning, and falling out before you start doing something about it. You want to start working on hormone balance, the proper nutrition, making sure you get everything that you need for hair support, for vitamins, minerals, and your herbal extracts. And you can build that into, it doesn't have to involve taking like 30 supplements a day. You can just build a lot of this into just routine so that you don't have to think about it. Maybe you take your regular supplements in the morning that are tweaked a little bit. You're adding some herbal teas that you sip on throughout the day, which don't have to be specific just for your hair. They can be specific for the immune system or adrenal support, and then have hair things built into it. You can do all of that and build them into one formula. So you want to make sure that you're getting on that early. The other thing that's a big player, dryness and vaginal atrophy. You do not want to let that get bad before you try and make it get worse, because you're literally dealing with skin and tissue that is supposed to be like a thick, strong tissue that's getting weak and friable. And getting that back, yes, you can. You can definitely get that back after, but it's so much easier to maintain. So just this constant work to maintain hormone levels, recognize when things are shifting early, and then get on the treatment part of it early. Muscle weakness and stiffness. This is something that I've heard so many powerlifters and so many actually in bodybuilders say, and I'm not saying that that's your goal to be at those levels. But if you look at someone who's at the top, what they need to do to stay at the top of their game versus what they needed to do to get there, it's like two totally different things. Like there's some guys who like used to spend hours in the gym every day, for years, and now to maintain, it's like, yeah, I work out like a couple times a week. It's what they can do to maintain is so much easier. So don't wait until you start getting pain or weakness, or you can't do activities and then realize, oh, now's the time I should start working out. I would say that today is the time you want to maintain this, especially for flexibility. Lack of strength and lack of flexibility are two of the most prominent signs of aging and function. Maintain those all the way through. And there's a simple routine could be start going to the gym, or do that during at lunchtime or in the morning, and at nighttime, if you're having a short workout during the day, when you're sitting there, if you're just kind of like cooling off from the day, reading or browsing YouTube or whatever, do some stretches while you're doing that. Like, just build those things into part of your routine so that when you're taking something that you like to do, combine it with something that you need to do. So I have found that works great. And when you do stretching like that before bed, you wake up feeling so much more rested and loose in the morning from doing that. Another really important one is inflammation and tissue damage. And I was just thinking of this because of a case I saw yesterday. I'm working with another client with really bad arthritis, and it's not obviously just inflammation throughout, but it's so much so that they now have joint damage. And I'm thinking to myself, if I'd known this person earlier, because if you stop, the inflammation is what leads to the tissue damage. But if you can address the inflammation earlier, which is not as difficult to do, you could have stopped the tissue damage from happening. So now that it's past that point, the tissue damage is always going to be there. We can reduce the inflammation still. We can still reduce the pain. But some of the range of motion and, well, if it's bone on bone, there's always then the pain. There's going to be some pain that's just not going to go away. So you want to prevent all of those things before they get to that point, because sometimes there is literally no going back. So get back to the basics. And remember that if we're talking about hormone balance, you're never too young to start. It's just that the treatment you might be doing would be different. If you're in your 20s and something's off with your cycle, acupuncture and herbs and diet work amazing. If you're in your 40s, herbs, progesterone work amazing. If you're in your 50s, estrogen and progesterone balance together, and then you can add in acupuncture and herbs, that works amazing. So again, you're just adding and tweaking different things for different ages and stages, but the concept always stays the same. So this is Doc Yates, and I hope this was helpful, and I hope I've encouraged you to keep your focus on maintaining your health. You want to recognize the things that you're good at and that you like doing, and keep doing those, but then you also want to pay as much attention to the things that where your weakness is, and put a little bit more focus on that. Don't just focus on the things you like. Spend a little bit of time focusing on the weaknesses so that you can turn them into your strengths. All right, Doc Yates signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.